Hello, everyone, and welcome to the DocTrePat Podcast. I'm your host, Tanishka. This series brings you conversation with leading doctors from India who are transforming healthcare for patients around the world. Today, I have the privilege of speaking with a highly respected name in orthopedics, Dr. Ishwar Bohra. Dr. Bohra is the Director of Orthopedics at BLK-Max Super Speciality Hospital in New Delhi. He has extensive global training from Spain, Scotland, and the United Kingdom, Germany, and India. His expertise includes knee replacement, hip replacement, arthroscopy, sports injury, shoulder and upper limb surgery, revision joint surgeries, and treatment of bone tumors, including osteosarcoma. This conversation is especially important for our listeners in Ethiopia and across East Africa who may be looking for advanced, reliable, and affordable orthopedic and bone cancer treatments. Dr. Bohra, I would like to begin by understanding the bigger picture. In your experience, why are joint and bone problems becoming increasingly common nowadays?
So it's a very good question, Taniska. You look at the changing pattern of the lifestyle and what food habits and job changes and living habits, everything counts for the any disease to be change their pattern. So nowadays, early joint disease is a very common and kind of epidemic. So look at the 2-3 decades behind, there was a onset of arthritis was at the age of 55-60, but nowadays you see onset of arthritis happens at the age of 35. So our mean age of the surgery is reduced drastically to less than 50 years. Why it is happening? Because of the lot of stress, physical misuse of body and change in the food habits, and I would say it is more or less increasing uses of the body also because of the competitive sports you see. So sports is a big carrier. So there is a wear and tear of joint is too much in the sports. You look at the total percentage of registered plays is increased almost double than the last decade. So that's the reason bone disease is increasing.
Okay. So, when you see patients from developing regions, including Africa, what are some of the most common, frequent knee, hip, and shoulder issues they present you with?
This is almost equal. I look at my data and the frequency of the patients from these developing nation. So they have equal problem. Mainly, I would say knee is the bigger problem. Then comes the hip joint, then shoulder. Because knee is uh, having the only two direction movement. Hip is having the multi-direction movement, and shoulder is much higher degree of rotation. That's why wear and tear is the less.
Okay.
So if your any joint is moving in one direction, then there is a chance of damage is high. And knee is a very superficial joint, that another reason for the getting early arthritis.
Okay. So, what are the early signs a patient should pay attention to, especially when it comes to persistent pain or restricted movements?
Yeah. So earliest sign of the onset of arthritis is the stiffness. If you think that before a 6 month or year my knee was moving freely, my joint was moving freely, but now I feel some resistance. I am not feeling it's the first comes feel. Then you suddenly feel that my terminal range of movement is not happening.
Okay.
Like your knee is not completely extending at 0 degree, not completely bending at 135 or 150 degree. So that is the earliest sign somebody should notice. If there is a persisting stiffness, resting pain is another important sign which should not be ignored.
Okay.
Yeah.
So, and finally, how does delaying a treatment impact long term joint or bone health?
To delay this signs, it means that you are ignoring what is happening to your cartilage, tendon, ligament, and support system of the joint. So they slowly lose their articulation, alignment. So that lead to the damage to the cartilage. What is the cartilage? Cartilage is a smooth layer at the end of the joints where the bone ends together they move with each other. So this end of the bone is kept with the one tissue layer that is known as a cartilage. So any weakness of the muscle or stiffness, or you would say that if you are not using your joint properly, that definitely having detrimental effects on the cartilage. So once cartilage started weakening and it is getting rough, you feel more pain, more stiffness, less walking, then this vicious cycle of the osteoarthritis and less movement starts. That completely damages your joint, and slowly you are progressing to stage 1, 2, 3, 4. So if you are ignoring all these stages, then you might land up in the surgery. So if you are at early sign of the arthritis which is developing or early onset is happen, then you can prevent it, you can delay it, or even you can cure it by doing the some pharmacological or non-pharmacological measurement. You can even stop it or even cure it.
Okay. So, over the last decade, joint replacement technology has significantly advanced. So, for what are major improvements have you seen in knee and hip replacement surgeries?
Yeah, as we discussed, because you see, it is a new modern epidemic of joint diseases. You must be knowing the increasing uh, diseases like diabetes, hypertension, and cardiac, and cancer. They are rampantly increased. So, regarding all these data, you look at the joint diseases. Joint disease significantly, almost it is double or triple than the what other diseases happen. So it is another new modern lifestyle disease.
Okay.
So significantly, in last decade, there is a huge rise in the joint replacement surgeries. So definitely, once anything in increase in the volume, then there is a lot of rectifications and technology comes to give them better result, to cut down the price, to give the better life to the patient. So joint replacement surgery has a huge innovation. So I will tell you about the how joint replacement surgery started and what innovation happens. So it is almost 75 or 80 years ago. Joint replacement started in USA by the greatest surgeon is Insal and Salvati. They started the joint replacement. So that was the only metal pieces we are putting on the end of the joint, and patient was getting pain free. So this was a beginning, but every beginning like our smartphone or maybe new cars you have seen. So joint also become like very high end and advanced technology. Then comes the patient specific instrument, patient specific jigs, and then computer navigation comes in the action, and computer navigation also having the generation 1, 2, 3. And now let us see the robots. So robots is really game changer in the joint replacement surgery. Because what happened before robots, the feel of patient was not natural. Patient was working very well, they having the pain-free life, they have a good range of motion, but still one thing which was missing in our patient was natural feel, natural gait. So robot is giving the individual customized solution for the joint diseases.
Okay. So, for patients who are worried about safety, how would you describe today's joint replacements procedures in terms of accuracy and predictability?
Joint replacement surgery really achieved a great success and almost 100% prediction. A patient is not having much medical comorbidities like severe diabetes mellitus or compromised cardiac or lung function, or maybe some neurological issues or autoimmune diseases. Excluding these patients, all normal patients having only the arthritis, they have a great result. I would say it is almost 100% prediction. Advancement at such a level that patient can go in the same day at home. What else you need? Patient comes in the morning or maybe same day evening or next morning, he can be on his or her feet and they are walking. So it is a completely paradigm shift of the joint replacement surgery because of new technology, robots and the implant and technique. So I would emphasize two things. One is the technique of surgery and one is the technology. What technique means? Technique means how surgeon is performing the surgery. What is advancement is anesthesia happen? What is the pain control? So these are in the heading of technique. So there is a great evolution in the technique. Like now we don't cut any muscle. So there is a very minimum pain.
Okay.
Size of incision is reduced to a significant level. So there is a very less tissue dissection. And because of robots and technology, safety is utmost at 100% because we are not cutting any muscle, we are not damaging any vessel, nerves, nothing. So this is 100% safe.
Okay. And how do you determine whether a patient needs a surgery or joint replacement as opposed to other forms of treatment?
Joint replacement is offered to those patients who are having the terminal arthritis. It means where other measurement of treatment like physiotherapy, exercise and nutraceutical supplements, or maybe less invasive procedures like intra-articular injections or other growth factor therapy and cartilage treatment which failed. So at this stage where pain is persisting, resting pain and deformity, these three are the major indicator for joint replacement. So anyone having the pain and this is compelling his or her to take analgesic every day, her gait is changed completely, they are walking with the duck gait or waddling gait, they are the ideal patient. And one is a deformity, your limb become bowed or maybe outer genu valgum, genu varus, whatever the deformity they developed. So these patients are the ideal patient for the joint replacement.
Okay. And what do modern implants and surgical techniques offer in terms of longevity and long term comfort?
Metallurgy, which is unseen part of the surgery. What does it mean? It is basically related to the doctors only and the innovators because patients and general public don't know about this. So metallurgy means how we are producing or manufacturing the implant, how it can be durable. So because of increase and the highest porous metal and equal to the human bone coating on the side of the implant, that makes them almost lifelong.
Okay.
So you must have heard about the uncemented hip replacement. We can do hip replacement at the age of 20 years. If patients having like avascular necrosis, sickle cell disease, or maybe traumatic arthritis, so we can offer them hip replacement to live their whole life. So in terms of statistics in the number, longevity of implant is more than 30 years.
Okay.
So nowadays we are saying that 30-year knee. So whenever you're growing, after age of 75, if somebody is getting the knee replacement at the age of 55 or 60, it is a lifetime for him or her. Because once you grow after 75, 80, then your demand of physical activity reduce. So wear and tear of that implant also reduce. So it indirectly increase the longevity of implant as well.
Okay.
So innovation in the high flex knee or uncemented knee replacement, which is recently launched in the many countries. US having the data of 10 years, but in India also we are started uncemented knee replacement, which is really game changer. It means that you can do knee replacement at the age of 30-35 if it is indicated. So in brief, I can say because of increase and high-end quality of implant, we can offer the younger population for the joint replacement surgeries.
Moving on, arthroscopy. Many people are not fully familiar with this term. So, could you explain what arthroscopy is and what situation it is most effective in?
Yeah, it is another sector of the joint surgeries. So you can divide broadly surgeries in orthopedics in three heading. One is the injuries trauma. These are the trauma surgeries. Another is the reconstruction surgery, which is known as a joint replacement. And a third vertical is the sports injuries, which is mainly confined to the younger population and players and athlete and sports population of the world. So between age of 10 to 40 year of the age, injuries which we can handle by the without replacement. So that is known as sports injuries.
Okay.
Where the inner part of the joints like meniscus, ligament and tendon, they become torn, they need a repair. So without making any larger incision, they can be dealt with the small keyhole surgery. In simple language, arthroscopy is a endoscopic or laser surgery or keyhole surgery. For a layman, they can understand it is a incision-less surgery, scar-less surgery, with the 3 or 5 mm portal, which is a keyhole. By through, we put the camera inside, and only with the same portal we can repair all the tissue which is damaged. So that is the arthroscopy.
Okay. So, sports injuries and ligament tears are becoming more common, as you said. So, even among younger patients, what injuries do you treat most often through arthroscopic procedures?
Yeah. So as I said, because sports is another upcoming, or you can say it is popular among the new generation as a career also. So they are getting more injuries because sports become is a very lucrative career, and many younger leagues are going on, like which is at the county level, and they make them at the international stand. So and pattern of the sports also change, like artificial grass and turf, and these are in the practice nowadays, not like natural ground and the lands. So these also makes them prone for the injury. So change in the technique and competitive aggressiveness and the lucrative career, three things makes the increased volume in the sports injury.
Okay.
And another thing which is like lack of some proper training, lack of good techniques to play, and lack of nutrition. These three are the other contributory factor which is causes the sports injuries.
Okay. So, what benefits does minimally invasive surgeries offer in terms of recovery, time, and returning to normal activities?
So its name is suggests a minimal invasive, right? Because you are not cutting any tissue, you are not giving incision, so healing time is very less. So
Okay.
typically, if you use a scalpel to cut the skin or muscle, it takes 3 weeks to heal. But if you go for the minimal surgeries, so there is no scar, so it heals faster. So recovery time is significantly reduced, and there is less stiffness, less postoperative pain. So these are the major advantage with this minimum invasive surgeries.
Okay. And why is early intervention so important for sports or activity related injuries?
As we discuss, if you ignore the symptom of the any injury or the pain, that keep on damaging silently cartilage, which is the backbone of the joint. So it is a kind of hardware, you can say, and these are ligament, meniscus, you can say software. So if you anything which is mistaken, like you are not taking care of the meniscus injury, you are not taking the ACL, PCL ligament or outer support system, then it will damage the core structure of the joint. So, so I would suggest that we should not ignore this kind of the injury.
Okay. So I would like to address a very serious area of treatment, which is osteosarcoma and bone tumors. So for families listening in Ethiopia and all over Africa, could you please explain what osteosarcoma is and who is most affected by it?
So because of the major changes in the histopathological diagnosis, means you can diagnose cancer at early stage, and imaging like MRI, CT scan and PET scan. So access of these facilities increasing everywhere. So that's the reason apparently you see that bone cancer is also increasing. But I would say bone cancer was like this, but there is an increase in the detection and the early identification of cases. Osteosarcoma is a very aggressive bone tumor which generally affect in the second decades of the life. It generally affects the area nearby knee joint or the hip joint, or maybe sometime the upper limb area of the arm. So this is the periarticular lesion or bone cancer of the bones. It is very aggressive. If it spread in the body, then it takes the life. So if you diagnose before it is spread to the liver, lung and other area of the body, then you can salvage the limb and life.
Oh, okay.
So limb salvage is a new modern advancement in the joint surgeries. Otherwise, you must have heard before that somebody developing cancer in the bone, lower limb or upper limb, so they have to amputate it. But because of advancement in the surgery and the implant, because now we can offer them the growing implant. So itself, you do the surgery once, and without any major surgery, you can increase the length of implant. So it is really miracle for the younger population which is in growing phase. Like any patients of the 10-year or 12-year of the age developing the osteosarcoma of the femur. So we cannot do surgery very frequently. So we can use the expandable implant. So just simply doing some minor things, you can increase the length because it's a growing age. So your one limb will increase, other will remain short. So it is really, really miracle or maybe boon to the patients of the pediatric age group.
Okay. So, what symptoms should parents and individuals take seriously, especially if they notice unusual swelling or persistent pain?
Yeah, it is very serious if your child or any patient's age less than age of 30 years, so himself or their parents, they should not ignore any persistent pain or change in the color of the skin over the joint or affected area. So cancer gives us some hint like affected area become little warm and blood vessels you can see. This is not normal. So it's very, very simple to identify. It is just to notice it. If a
Blood
child,
vessels you can see
yeah.
as in?
So on over skin you will see the some reddish. If you hurt your skin somewhere, then it become little reddish,
Yeah.
Yeah. So same will happen with the cancers. So because body try to take away the toxins of the cancer, so body it is a defense mechanism body, which is increasing the blood flow. So you will feel little warmth over the area, some prominent blood vessels there, and some swelling. So your size will be increased, and it may restrict your movement of the joint. So if these things are you can notice, so immediately you can take expert opinion. You can get done biopsy, X-ray, MRI, whatever they suggest, and you can detect early, and you can salvage your limb and life both.
Okay. So, when treating osteosarcoma, how do you decide between limb and salvage and more extensive procedures?
Limb salvage is definitely extensive procedure because we have to tumor without exposing the normal bone. So we identify on the scans that this area of the bone or joint is affected. So with a little normal area of the bone we resect, we measure, and we put a customized implant there. So that way we can salvage the limb, so patient can get the same movement what we are having before that. Another thing which why it is extensive is the plastic surgery. So because we have to remove lot of the normal tissue also, to cover them we might need some flap cover or the microvascular surgery. So it is a teamwork. So we need a excision plus reconstruction and customized implant. So we need a 3 team which one can excise the massive area of the destruction. Another expert put the customized implant to give the limb length equality in the movement, and another person which is a reconstruction surgeon who can cover that implant and the defect of the tissue which is removed for the cancer.
Okay.
Yeah.
So, for a layman, how someone can identify the bone cancer and proceed for the treatment?
So for a normal person, if somebody is having the persistent pain, swelling, loss of range of motion, or some superficial skin changes, or maybe some discharging thing, so this is definitely should not be ignored. And X-ray can be done anywhere. So major cancer like osteosarcoma, Ewing sarcoma, and soft tissue sarcomas, histiosarcomas, there can be simply identified in the X-ray, which is everywhere available. If it is in very early stage, then your doctor can advise for the MRI or the PET scan. So in this era, it is not difficult to identify the cancer. It is only thing which I suggest everyone that we should not ignore any joint or periarticular swelling, pain, stiffness, redness, or warm feeling. These are the very, very common symptoms which should not be ignored.
Okay.
Because in generally pediatric age group, there is no pain. Only children or maybe adolescent can have pain after injury. If there is no injury, then definitely this is a serious indication we should not ignore. Once you diagnose the cancer, then it is a worrisome for family, for children, everyone. That is an emotional setback. So no need to worry for that, because if you are lucky that your cancer is diagnosed at early stage, then you can cure it and you can have a normal life. Only thing which we should do is the proper treatment. So once you have a suspect or diagnosed with the cancer, you meet with the expert, he will guide you. So to understand what are the available treatment and at what stage and how complex is, so I would say it is very simple. We have to do the staging of the bone cancer, like osteosarcoma, Ewing sarcoma, or giant cell tumor, or aneurysmal bone cyst, or maybe complex tumor. So these all tumor having the stages like early stage, medium stage, or last advanced stage, where the tumor is spread in the body, mainly in the lung and other bones and liver and blood. So that is the terminal stage. Before terminal stage, there is a early and the medium stage, where we can treat the cancer with the small surgeries or the adjuvant therapy. Adjuvant therapy include the radiotherapy, chemotherapy, immunotherapy. So these are the latest adjuvant therapy which cures the cancer at some extent if you diagnose at early stage. Combining with surgery, definitely you are salvaging the limb and life. So at early stage, surgery will also very simple and result will be much better. An advent of technology like robots or 3D printing or customized implant, so this technology really give the actual length measurement and the precision of the surgery, so they can have a normal life. So for a layman, I will say, if you diagnose with the cancer, no need to worry. Take expert opinion. They will do the staging of the disease. They will guide you treatment, that you need surgery, chemotherapy, radiotherapy, immunotherapy, and what is the post-operative follow-up. Because some cancer need the long-term immunotherapy, immunosuppression, or maybe chemo or radiotherapy in follow-up. So that is a set pattern for the all type of the cancers, and that may cure your disease.
And how important is timely diagnosis in ensuring the best possible outcome for the bone tumor patients?
Yes, just I said, time is very important in the cancer. If you delay the treatment, then it will expand its capacity, because it will completely destroy the joint where sometime it is not possible to reconstruct the joint. If like any tumor which is at the end of the thigh bone, and it involves the lower end of the thigh and the upper end of the leg where your patella bone is lying, and it extend the knee and flex the knee. If your patella and the patellar tendon involved, then it is a big problem, because then you cannot salvage the limb. Then you have to arthrodis. Arthrodis means fusion of the joint, where you lose the movement. You can salvage the limb, but you lose the movement. So that's the reason time is very important. If you delay the treatment, then your disease will spread and your outcome will be not good as you intervene at the early stage.
So, a growing number of patients from Africa travel to India for orthopedic and bone cancer treatment. From your experience, what motivates them to seek treatment in India?
Yes, India is a now destination for the medical treatment. Not only Africa, we are getting patients from the Europe, Australia, even America, everywhere. So majorly, look at the Indian healthcare system, and the capability and skill level of the Indian doctors is relatively higher as is prevailing in the all over world, and India is not behind in any technology now. So whatever advanced technology we need for the best care we have, like uh, latest robots, Da Vinci robots for the soft tissue cancer surgery or maybe bone cancer, and 3D printing and customized surgeries, everything we have. So that makes them to get the confidence that we are not going any place like where no facility will be there. Another thing, cost, and the some cultural similarity with the Indian culture, and feeling of homely. So these 3-4 factor which is really give the India upper edge to the other part of the world. And in BLK-Max Hospital, we treat our patients like our family, because they are traveling from abroad and there are a lot of challenges with them, like stay, food, and feeling loneliness and finances. There are many things. So we are doing this international patient treatment since last 2 decades. So our team and our members of the team are so groomed to take care of them that they have a great confidence in our team, and we deliver the best treatment.
Okay. So, what makes BLK Max a reliable and advanced center for international orthopedic patients?
BLK Max is I would say it is one of the pioneer in the getting the international patient. So we are first in the country to start the medical tourism.
Okay.
So our international team is having the branches and offices in almost all the countries of Africa and Middle East and Central Asia, and now they are going to the Singapore, Dubai, and Europe as well. So because of having the physical presence in their country, that gives a strong confidence that we are going to a secure place and guaranteed place. Another thing which is very strong in BLK Max, that BLK Max is regularly conducting overseas OPDs. Like we are regularly going to Ethiopia, Kenya, Tanzania, Uzbekistan, Sri Lanka, Nepal, Bhutan, everywhere in the world. So these our regular OPDs give them confidence that you got the treatment at that time, and same surgeon or maybe team from that member from that team will see you then you're at home country. So that is the strong system which we have in the BLK Max, and we are very competitive, and we give the result at par of the Western world.
Okay.
That makes the very extraordinary to the BLK Max.
Okay. So, for someone in Africa who wants to consult you, what does the process look like before they actually travel?
So it is a basically core matter of my international team. Being a surgeon, I guide them because any query raised from there, my team directly connect to me, and we have a system of teleconferencing or video calling system. So they send me the report, I go through the report, and if I feel that report is not adequate, so we quickly arrange the video call or teleconference, and we identify the actual problem. Because once patient come here from far away, so we should have some plan, because patient should be mentally prepared, because a lot of finances involved and other things involved, logistic. So we try to give the almost near normal plan which should not change. So video conferencing or teleconferencing give us the clear out idea about the patient's disease and treatment plan.
Okay.
So once we finalize the plan of treatment and the cost of treatment, then my international team handle all the visa, travel, stay, food, everything, so that we have a proper system of the patient care.
Okay. And once they arrive in India, how do you and your team help them through treatment, recovery, and rehabilitation?
So once, because of we have the preliminary reports with them, because we already worked up, so if any doubt in the diagnosis, once we see the patient physically examination, we do the reinvestigation, then we again recheck all the security system that its treatment plan is okay. So once we finalize the plan, we suggest for the surgery, we admit them, and our physio team and our ward team, they take care of them in the pre-operative, post-operative, and rehabilitation. They stay for a couple of days or weeks, depend on the recovery. So we have a home care system also here. So members from my team which go where they stay and they give them care, and my international team take care rest of the things.
Okay. And many patients fear surgery and believe it is very extremely painful. So, how would you describe the actual experience of a modern orthopedic and bone tumor surgeries?
So it is a myth that it is a very painful, because the which I before I told that invent in the technology and techniques, because we have a patient control analgesia system, PCA. It means we have a system where patient himself or herself can control pain. So we put the pain control system, and we guide them that how they can use this system to control the pain. And because of like technology, robots and 3D customize, accuracy of surgery is very high, and incision is reduced and soft tissue dissection become very modest, so pain is automatically comes down. Our pain team is dedicated for them. We have a separate team for the pain management.
Okay.
So they frequently, whenever need of the patients arise, they go and manage the pain. So it is virtually, I would say, at the scale of 10, very rarely some patients have pain by 5 or 6. Otherwise, they are very settled with the 2 or 3 pain.
Okay.
So, in simple language, you can say it is a painless surgery nowadays. Yeah.
So, cost is another major concern for international patients. How can families evaluate treatment expenses realistically, especially when comparing India with other countries?
So this is the one of the most powerful uh, things which we have, because India is very, very cost effective, very affordable to comparison to the other part of the world like Europe. Price here, maybe one average surgery is 1/10 of which is they are paying in the Europe and America. So it is very competitive, and we fairly give the idea about that amount they will need for this surgery. Like our knee replacement surgery, hip replacement surgery, maybe some eye surgery, maybe some spine surgeries, and they have a very, very competitive package system. It means fixed price. We take care of them in that package, everything. Even sometimes some complication happen, we take care of them also in that same the price. So we are most cost effective in all over the world. So cost is not an issue in the India to getting the best treatment.
Okay. There is also fear around the idea of joint replacement and tumor surgery being risky. So, what would you say to someone who feels unsure and afraid of surgical treatments?
So joint replacement and bone tumor surgery cannot be combined together, because joint replacement surgery is the safest surgery in the world, because this is the most predictable and very, very fast and quick surgery and safe surgery. So now we are having the day care arthroplasty, means in one day you can change your joint and you can go home. But bone cancer surgery is not like joint replacement surgery. It is a joint replacement, but it's a different joint replacement, because it involves a lot of the tumor resection, and some time we have to cover the defective area by the plastic surgery and microvascular surgery. So it is safe, but it is sometimes extensive. So patient need to stay in the hospital for a couple of days, and they need a follow-up for many weeks.
Okay.
So joint replacement is very quick, predictable, and bone cancer surgery is almost safe, but they need some time.
So, and for those who worry about traveling long distances, how safe is it for patients from all over Africa for treatment in India?
To travel India is not a problem, because flight is very frequently now, and after surgery to travel is not a problem, because as I said, joint replacement surgery is very quick. So even within a less than a period of week they can go back. Yes, with the bigger surgery like bone tumor surgeries or the kidney transplant, liver transplant, they are the major surgeries, so they takes time, but they are absolutely safe to travel back. They can go to the flight, because we give them fit to fly certificate, and once we feel that our patient's rehabilitation is perfect and patient is fit to fly, so they can travel back, it is absolutely safe for them.
Okay. So, you have treated thousands of patients over the years. Could you share one story of a patient who experienced a strong recovery after joint replacement?
Yeah, one of my patient from Baghdad, I done his knee replacement, So it is very funny and surprising for me also. So I went to discharge him and I told that you can go home. So he understood that I have to go back to Baghdad. So his ticket was open and he went to airport and took his flight and back to the Baghdad. And at the airport from Baghdad, he called me on the video and said, "Doctor, I'm okay. I am at Baghdad. Thank you very much." So it was like me for, I told him that, "Gentlemen, I told to go to the apartment, to the hotel, but not to the Baghdad." So that was very, very funny for me, and it is very surprising. But contrary, that gives me confidence that yes, patient can go back.
Oh, okay.
So that quick kind of surgery we have. So my nearby direct flight patients generally now goes from hospital to their country. They are not staying in any hotel or the apartment. One another example of success story is we have a huge experience of the obese patient joint replacement. So because look at the Asian population and African patient and maybe European, so there's a difference in their morphology. So patient from Africa is having the high BMI, high body weight, and the taller structure. So their joint is different. So slowly, last 3 decades we are doing the joint replacement surgery. So there was a lot of restriction on the joint replacement surgery, like high BMI we cannot operate, morbid obesity we cannot operate, sleep apnea we cannot operate. But nowadays we have all restriction is removed. So we have highest experience of doing the obese patient joint replacement surgeries. We have done patient from South Sudan. We have done 150 kilogram patients both knee replacement. So this much of the success we are getting in the joint replacement surgery because of technique and technology. So this gives us the confidence to treat my African patients.
Okay. So, could you also share a bone tumor or osteosarcoma case that stayed with you?
There are many because invent of the imaging and the early identification, we are getting many patients. So my patient which we have operated, they travel back within 6 weeks because sometimes osteosarcoma patients need post-operative chemotherapy. So we need a 3 cycle before surgery and maybe 3-4 cycles after surgery. So their stay become little longer than the other patients. So my many patients, they send me the video from their country. They are dancing, they are doing swimming, and they are going back to school without fear because this diagnosis of osteosarcoma, having sarcoma, this cancer diagnosis is a great emotional setback. And there is a myth that it spread to the other one also. So they drop from the school. So that after surgery they can resume their school education and they progress further. So that gives a good satisfaction. There are many success stories with us.
So, have you treated patients from East Africa, and what stood out about their treatment the most?
Yeah, Taniska, I don't very much, politically or demographically knowledgeable, but yes, I have done the many patients from East Africa, probably like Sierra Leone, Nigeria, Niger, and these countries, I think on the eastern side of the Africa, if I'm right.
Yes.
Yeah, so I have a great experience. I've been to travel to Sierra Leone 3 times, and we have a good contract with the Sierra Leone army and soldiers from there. Their shoulder and gunshot injuries, and we treated them with the great deformity they have developed after the war and some accidents and gunshot injuries. So we have a long series of the patients from these countries where we have treated like deformity and sports injuries and bone cancers, and their eminent leaders from there, and soldier, which are the key security personnel there. So we have a lot of different kind of the herd of the patients from there, and almost in all category: joint replacement, sports medicine, bone tumor, bone deformity, and post-traumatic deformities, we have treated them with a great success.
Okay. And personally, what moments in your career remind you why you chose this profession?
This is really very uh, I mean, for me, to become a joint replacement surgeon is not accidental.
Okay.
In 10th class, I was aware that I have to become a like surgeon.
Okay.
So there is not a particular motivation factor, but because my parental side where I born and brought up, so there were a lot of the fluorosis was common and the joint disease was common. So that factor really motivated me that my this population should not suffer from the joint diseases. And that time joint replacement was not very successful and not popular. So once I finished my post graduation, and that time joint replacement was emerging in the India.
Okay.
Yeah. So that really motivated me, and I was lucky to get the residency with our very famous joint replacement surgeon in India, is Dr. K.T. Dolakia, who
Okay.
started joint replacement in India. So I was with him in Mumbai, Bombay Hospital. I started my journey from there.
Looking at the next few years, what advancement in joint or bone surgery are you most excited about?
Yeah, we are already having the very exciting things, which is robot in technology, and in implant. You see, the very recently we got the uncemented knee implant, which is really going to boon for my patient. Another thing which is coming is the 3D printing and customized implant, because cost is very high to design customized implant for everyone. So once AI and the 3D printing and customized technology become cheaper, it will be accessible to everyone, and I'm sure that will give the very natural joints to everyone once somebody is having the joint disease.
Okay.
Yeah.
So, how do new technologies and innovations improve the outcome you are able to deliver for patients?
So I think nothing can be fast than the daycare surgery. So that is the beauty of the technology and the advancement. So maybe some biological advancement may uh, give the reversal of the arthritis. That could the future possibility, where you might not need to the knee replacement, but you might do the some biological treatment which reverse the disease, which we don't know. But looking at the joint replacement advancement, it is yes achieved almost near normalcy, where the patient can get the daycare replacement.
So, Dr. Bohra, we'll have a quick rapid fire round now. So, one habit that keeps joint healthy.
It is discipline.
Okay.
Discipline about eating, discipline about exercise, and discipline of sleeping.
Okay. And one myth about joint replacement you want people to stop believing.
It is painless surgery.
Okay. And one symptom that should never be ignored.
Resting pain.
Resting pain. Okay. One surgery that changed your career.
One surgery changed my career. That is really, it is a joint replacement.
Okay.
Absolutely. I was doing the orthopedics in toto, like I was doing arthroscopy, trauma, infection, tumor. But once I have started joint replacement, it really changed my career.
Okay. One message you give every patient before treatment.
trust your doctor, know your disease, and be patient.
Okay, great. So now moving on to next segment. Dr. Bohra, for our listeners in Ethiopia who may be facing joint uh, problems, sports injuries, or bone tumor concerns, what is your message to them?
My message to all my Africa patients that we should not ignore any disease which we can identify at early stage by having the simple common sense of the symptom of disease, by not ignoring the pain, swelling, deformity, and which is not usual features present before that problem. So by doing this simple measure, you can avoid big diseases.
And finally, what would you say to someone who is delaying the treatment due to fear, uncertainty, or lack of information?
My message to these people who are afraid or delaying their treatment, there is no need to afraid for the any surgical procedure in this era, because almost all surgeries are very predictable, safe, painless, which really can transform their life. So my message is very clear: don't ignore your disease, don't delay your disease, and get proper and timely treatment.
Thank you, Dr. Bohra. To our audience, if you or someone you know is dealing with joint pain, injury, or a suspected bone tumor, early action can make a life changing difference. You can reach out to DocTrePat or connect with BLK-Max Super Speciality Hospital to begin your treatment journey. Thank you for joining us. This is Tanishka, and I look forward to seeing you in the next episode.